Hello, everyone. I hope everyone's doing okay as we start getting back into some sense of normalcy within our society, as more and more people are starting to receive COVID-19 vaccinations, and we start really breaking through this pandemic. My name is Anthony Chillo, and today I would like to talk to you guys about the social idea about anti-vaccinations and people being anti-vaccinations and refusing to receive the COVID-19 vaccination. So, before we get into vaccinations and the idea of anti vaccination, I would like to really take us back to the beginning of the pandemic, to where it all started. And the first cases of coronavirus were found in Wuhan, China in December of 2019. Now, this coronavirus disease, we all know it was very deadly. It is an airborne virus which is very, very, very deadly because it is so easily contractable. And when you have COVID, you may be asymptomatic or you may not, and you may be dealing with mild to moderate respiratory illness. But if you're older or have underlying health conditions already, it is very scary because this can lead to death, as we've seen so many deaths across the nation and across the world in the past year. Now, some of the symptoms of COVID 19 are fever, cough, fatigue, shortness of breath, along with many other symptoms. By early January of 2020, we all started hearing about the COVID 19 disease and how deadly it was and how fastly it could be spread. But none of us really knew what was going on, and our government officials were trying to prevent this disease from coming to our country and spreading all over the world. But by that time, it was too late because people were traveling all over the world, and with no restrictions, people were just spreading this disease all over the country and all over the globe, and many countries were affected, such as the United States, Brazil, India, Mexico, and even now India is facing it terribly, and our prayers should go out to them because boy do they need help. For us New Yorkers, I feel that the COVID-19 disease really started to resonate with us during late January and early February as we were seeing what was happening globally. And these countries were just being decimated, such as Italy, where they have such a high older population that there was just so many deaths within weeks of them receiving their first COVID patient. And then on March 1st, sadly, New York City had its first COVID 19 case. And then just within weeks, our city was shut down, the city that never sleeps, and we saw restaurants close, schools close, theaters close, and all non-essential businesses close. But we did have essential workers working, such as EMTs, nurses, doctors, these people who work in the hospitals and who were saving lives because there was so many people getting sick, and these people just served as the backbone for our nation through these tough times. The impact of COVID 19 was tremendous, as we all know, as it affected us as a people and our economy. There's more than 100,000 businesses in the United States that had to close permanently due to the COVID 19 pandemic. And as of May 12th, 2021, death totals for the United States due to COVID was almost 600,000 people. And globally, there's 3.2 million people dead because of the COVID 19 pandemic. Throughout this pandemic, we as a people continue to fight and preserve, and now we do have a chance of getting back into some sense of normalcy within our society amid the COVID 19 vaccine. As we all know, in December of 2020, COVID 19 vaccines started to become available to the population. Now we have three COVID 19 vaccines, which consist of Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna vaccines consist of two shots which are 2 weeks apart from each other, and the Johnson & Johnson vaccine consists of only one shot. Now, these vaccines do have different effectiveness ratings, as the Pfizer vaccine is 95% effective, the Moderna vaccine is 94.1% effective, and the Johnson & Johnson vaccine is 66.3% effective. Now, these vaccines are so important because they give people a sense of mind, a sense of safety, a sense of normalcy, as even if they do contract the virus, as long as they have the COVID 19 vaccine, they are much less likely to die and have serious conditions. And for some reason, many people do not seem eager to receive the COVID 19 vaccine. Now, this brings us to the social idea or the social dilemma that people do not want to get vaccinated and they are anti the vaccine. And many people do not believe in the COVID 19 vaccine, which is strange because many people did not believe in the COVID 19 disease either. But we've seen what happened and it's killed many people. The disease is very, very real. And this is why people are somewhat reluctant to receive the vaccine because they just simply don't believe in the virus or the vaccine. As I previously stated, there are many non believers within the COVID 19 disease. And one of these reasons is because many people thought it was a political hoax in order to get former President Donald Trump out of office. And this may be absurd, which I think it is, but now people are refusing to receive the COVID 19 vaccine as new President Joe Biden encourages Americans to receive the vaccine in order for us to get back to a normal life and not be afraid of dying or getting very ill from the COVID 19 virus. Another reason why people refuse to receive the COVID 19 vaccine is because they do not simply trust or believe in the science behind it. As other vaccines have taken years to create, people question why the COVID vaccine has come about so quickly. However, the vaccine has actually been in work for years, as SARS, the sickness we are currently dealing with now, is part of the COVID family. There are different diseases in the COVID family, so scientists have already been working for years on a vaccine for several COVID diseases, so they do have the science for years to support this vaccine. A huge reason why people are anti vaccine or do not want to take the COVID 19 vaccine is because of the unknown. And the unknown is what could be the long term effects of the COVID 19 vaccine. Now, we may not know for years to come. However, more recently, the Centers for Disease Control and Prevention found that 28 out of 8.7 million people who received the Johnson & Johnson COVID-19 vaccine have cases of serious and life-threatening blood clots. Now, one of the other reasons that people are anti-vaccination and do not want to receive the COVID-19 vaccine is because of the side effects that may come along with it. Now, these side effects can include fever, headache, chills. You may be sick for a day after you get your second dose of the Pfizer or Moderna, or your first dose and last dose of Johnson & Johnson. One of the reasons why people refuse to receive the COVID-19 vaccine is because of past events that happened in our nation. And one of these events is the polio pandemic and the polio vaccination. Now, in 1894, the polio pandemic swept across the United States of America. In 1954, a vaccine was created to prevent people from receiving polio. But sadly, the results were not good. 120,000 children received the vaccine, and sadly, the vaccine left 51 children paralyzed and 5 dead. And sadly, anti vaxxers look at this past and say, no, I do not wish to receive the COVID 19 vaccine. One of the last reasons why people are anti vaccination is because of one simple and complex idea, which is freedom. See, many people believe that their value and beliefs are being stripped from them because they are being told to wear masks and to get vaccinated. There has not yet been a mandate for vaccinations, but this has happened in the past. In 1905, Mr. Jacobson refused to receive a smallpox vaccine that was required by the state of Massachusetts. However, the court decided that the vaccine order was valid and the threat was serious. See, many people believe themselves to be patriots and like to disregard what they do not believe in, whether science supports it or not. So, whether people like it or not, some people are going to receive the vaccine and some people aren't. Some people are just tired of them feeling that their freedom is being stripped away from them, and they do not care about the science that backs up the vaccine or the disease. In closing, I understand why anti vaxxers, the people who do not want to be vaccinated, have their reasons, and they have every right to. However, at some point, don't the benefits outweigh the potential risks? Throughout the pandemic, there have been many debates and arguments, but can we all come together as a nation and finally be on the other side of the COVID-19 pandemic? Thank you guys for listening. If you guys have any comments or questions, please leave them below. Thank you.